The National Urban League is a historic civil rights organization that was founded in 1910 to deal with the ills that are happening to vulnerable populations. It started off with African Americans or Black populations and has expanded to populations in need all over the country. During COVID-19, our affiliates really stepped up, did all the things that we need to do to cover the social determinants of health. And the social determinants of health are all the aspects around health that are not medical, that impact somebody's health. And so what really happened during this time is that they realized the need in the community, that COVID was really impacting particularly African American, Latino, Asian communities, Native communities, more than it was impacting other communities. And so they really built together and bonded together idea of how do we help people out.
We pivoted, and I know people use that word all the time, but we really did. We shifted gears, we changed the way we did our work in the community, and we really looked at how we were going to serve people, boots on the ground, what their actual needs were going to be.
We did 22 large-scale food drives every Saturday.
We started with our grab and go program. That's where we let kids, students ages pre-K through 12th come up and just get meals. They just didn't have to get out their car. Basically, we stood out in the front and just handed them meals.
When we needed to help people with emergency rental assistance, we scheduled appointments. We made sure we had all the proper procedures in place when it came to PPE, people washing their hands, keeping distance, so that we could make sure that people who were being laid off and losing their jobs, almost overnight it felt, could still have a roof over their heads, especially as it was not quite yet spring. We were still in the middle of winter, and so having to deal with all of how am I going to pay for all of this for my family when I can't be at work. We wanted to be able to make sure that we showed up for our community that way.
And I remember early on, our team, we had Zoom meetings, we talked about it. We talked about our own fears. We had a doctor and a nurse come on and answer questions for our staff, because if they're not educated, if they're not comfortable, they're certainly not going to do that to the individuals that they serve, with their family members, and even, when they're talking to community members in general in the street. We want them to be armed with good information so that everyone has an opportunity to be educated and be protected.
Our Wellness on Wheels mobile unit program is one where we've been able to increase access to healthcare to underserved, underrepresented communities. It is health equity in action. It was utilized and mobilized pretty quickly. About 45 days into the pandemic, the Wellness on Wheels mobile unit was already being utilized as a rapid testing tool across central Illinois, as well as hotspot communities.
When they started distributing in-home testing, we made sure that we sent them the in-home testing, those that could manage it on their own. I mean, there's been times when I literally sat on the phone and basically walked someone through taking a COVID test.
That was our strategy, to be in as many community spaces as possible, community resource fairs, at churches, at outdoor events especially, because you could kind of spread out and people would feel safe. As part of our budget, we purchased these really cute hand sanitizers that say the Greater Milwaukee Urban League on them, and then when people pick them up, you get to actually engage with them because they go, how does this work? So you built that instant relationship with a question and an answer.
Some of the students were really struggling, especially when they went back to school. And we had did a 3-part series on that, about going back to school, and had collaborations with different organizations. And, we had a pediatrician it was a 3-part series, and the first part was for everybody. Like, how do we deal with the stress of going back to school? And then one was just for the parents, and then one was for the kids, so that we can help address that. And then there were some parents that were on those calls that really were struggling with, do I send my kid back to school, and they possibly can get sick.
What we then did as a national office is we came together to think, how can we help get people vaccinated? We know that in the early days of the vaccine, African Americans in particular were not getting vaccinated at the same rate of other groups. And so we got together with our affiliates to think about, and we're funded by not only the CDC, but also HRSA, which is the Health Resource Services Administration, to help our folks get vaccinated. And what our affiliates went out and did is outreach and education, and all the activities that they do. They had information available for people when they came for other services, and they really educated the people about the importance of getting COVID-19 vaccinations for their health, for their families.
We saw that early on, that the New York State website was a challenge to try to get an appointment for the vaccine. But our Urban League of Rochester, we said that we have to find another way. And we partnered with Trillium Health. And Trillium Health, it just was a relationship that I developed with their CEO. We had a regular monthly meeting. And through that meeting, we strategized. And the next day, we had a process. We had a process to open up appointments for our elder community.
The governor's office asked if the Urban League can help the National Guard get into 5 senior facilities. 5 senior facilities became 70 senior facilities. And then we did the school districts. We did the teachers, the faculty. Then we did the postal workers, and we did the mail carriers, and then we did the hotel employees and the grocery store employees. And so we have been literally immersed in this COVID response. We've been immersed in putting shots in arms.
So at these vaccination clinics, there were several people who were very thankful, but there was a specific older Black lady who came up to me and she just gave me this huge hug. And she was crying, and she just talked about how she had been going online every week trying to get in the vaccine clinics in her neighborhood, and they just kept filling up. She had been going through this for weeks, I think more, maybe even months. And so it just showed to me the necessity of going where people are.
The first phase for us was getting vaccines to those who weren't able to get out, right? So we had a program called Homebound, where we would have local nurses come and actually provide vaccines to people who were restricted to their home. We worked again with the Foundation of Healthy St. Pete and a collaborative called Beat COVID Pinellas to get on the street and start setting appointments. We developed pop-up vaccine shops, as I called them, where people could get vaccines on the spot, as well as making those appointments so that people can go and get those vaccinations.
As a part of our response, we were able to purchase a medical-grade refrigerator and freezer that can carry those vaccinations not only locally, but across the state of Illinois.
We worked together to even identify and cite good locations to reach Black and Brown community members or other groups that trust the Urban League, but maybe didn't trust healthcare partners or the health department.
We had a Wellness Wednesday event, we had 2 trunk or treat events, and every single one of those events, we had an all-in campaign component. And the public, while they were having fun out there, doing different activities, had the opportunity, without an appointment for free, to come take a vaccine or a booster.
In partnership with our wonderful Health Equities Department, we've been able to bring the vaccine clinics to our career fairs. In order to get employment nowadays, a lot of employers are mandating vaccines. And so we want to make sure our citizens not only are coming to our career fairs to learn about resume building, learn about interviewing, potentially getting a job. We want to break down barriers to employment, and one of those would be getting a vaccine.
Our Young Professionals organization, they do an annual backpack giveaway. In the fall, we served almost 300 kids, giving them backpacks to go back to school. And that was a perfect time, again, to continue the awareness and get parents vaccinated and also convey importance for them to get their children vaccinated.
So in the community level at the schools, to see parents walking to get their kids vaccinated when they didn't otherwise have transportation, that changed the game. In our religious communities and our religious partnerships, seeing the church come together and open its doors to their surrounding community, that was a game changer. To look at partnerships with other entities outside of the community, once they started seeing the momentum, offering, hey, advertising our events, it brought us all closer.
We knew that when COVID first hit, we had to not only be an economic first responder, but we also had to be an educator about what this virus meant to the African American community and for the marginalized folks.
With the COVID-19 pandemic really showed us that we haven't done the best job of explaining things in a way that people can understand. And so that's why it's so important to partner with trusted community partners to really relay that information in a way that's easily digested.
COVID changed our health initiative. We had to really pivot when it came to COVID. First thing, we know that African Americans weren't trying to hear anything about getting a COVID vaccine. So we had to use our influence, we had to use our relationships, we had to use our partners to get out in the community to let people know that it's safe.
I was able to create vaccine educational materials that spoke to exactly what the community was sharing with me that they needed. And so the Black Health Matters initiative really began as a guidebook. So a 20-page book called Black Health Matters. And it is very in-depth. It's everything that I learned about the vaccine, and it's everything that I would have needed to hear and that I think people around me needed to hear.
And then we made sure that our kids had the information when they were getting ready to go back to school, and the parents on why it was important to make sure that our kids were vaccinated when it was available.
At one point, I think we had doctors and nurses and from the Urban League. We had the housing, we had mental health, going door to door and giving information, and people were like, whoa. So doing those type of efforts, and that's how we did it. It's just a lot of factual messaging and, and being consistent and just being there, and sometimes sharing your own story, why you were hesitant, really diving deep into what is the hesitancy and not judging people and just listening to people. And some people may not be ready, and that's okay, but at least making sure they have the factual information and respecting their agency to make the choice either way.
We created a speakers bureau with over 150 scientists. Actually, we had over 200 scientists in that speakers bureau. 120 of them were Black. And so having experts on deck to provide to speaking events in local communities to ensure that people were hearing voices and hearing experts that look like them.
Throughout the whole pandemic, we've been doing our all-in videos, and so asking regular, everyday people, why did they get vaccinated? So just hearing all the stories of people that you just see in the grocery store, and I think that changed, not everyone, but a good portion of our constituents' mindsets of like, I know them, they live next door, I wonder. And then they're having those conversations with those people, but it's really just been, I know somebody because the Urban League shared their story.
As a person of color, but also a Black pharmacist, those are two things that I always tell folks that representation 100% matters. People have given me the feedback, I trust my Black pharmacist. Like, if you're giving it to me, I'll come. But if it's somebody else, I'm good. And so partnering with an organization that cares about the lives of BIPOC folks, Black, Indigenous people of color, and just Black people, period, was really, really important for me when I thought about the organization that I wanted to partner with.
We made it real clear that for refugees and for immigrants that they could come to a place and feel safe, that they would not have to be challenged with ICE or any of those regulatory folks coming in, so that, they come into the school, it's a safe space. We're not collecting any personal information. We just want to verify that you got the vaccine. We don't share any information. And we took great care, relative to maintaining the privacy of individuals participating in those events.
In our community, we had literally 2 apartment complexes built during that time. So it would be negligible on my part that if you have 1,000 units around your church, not to let your voice be heard. And so we literally went out there knocking, and we scattered the whole area to just let people know this is the right thing to do. Many people had already been vaccinated, but you're still combing the area, just trying to make certain that we're doing the right thing. We're giving our due diligence.
You know, the statistics shows that people of color don't do a high level of volunteering. But I'm letting you know that very day that we had the announcement on the stairs of the Jacobs building here in our city, and we had pastors, African American nurses, doctors to come out to say, we will not be left out. We are leaders in our particular industry, and we will speak loudly about access.
I have been able to relate to community members because I don't dismiss what they're saying, because I have experienced discrimination in the healthcare system and can identify with a lot of things that they're feeling. When I was on site at a community vaccination clinic and I sat and I listened to a military service member talk about PTSD and how COVID was triggering his PTSD, and being now on the front lines as an essential worker and just asking questions about the vaccine and no one being able to really provide the answers that were satisfactory to him. So, we sat down and I said, come out of line. You don't have to get vaccinated today, but let me talk to you about it and let's just have a conversation and let me get to know you. And we spoke for like 30 minutes about life, a little bit about vaccination, but life. But at the end of it, he was like, I feel so much more firm in my decision. And the reality is I have 6 kids. I have 2 jobs where I'm an essential worker. And I'm going to do this today. And it's really because you were here to hold my hand and make me feel so comfortable. It really demonstrated the importance of presence in the community.
One person in particular, more than one, but I'll just use one, a brother that, man, I'm all right. I'll be all right. I say, man, you don't want this. So it took me a while, but he was able to see, I said, man, I got a shot. I gotten all the shots. And I was able to really work with him. And he was the one person that didn't have any side effects and was bragging about, oh, Pastor, I'm fine. Look at this, But in the midst of that, what it shows is that sometimes it's a slow build and you just have to be persistent without being nagging. And we had to be patient, and eventually it'll work.
With Wellness on Wheels, we had already built those relationships with the community. People knew us, and they knew that they could trust what we were saying. They knew that we were not there to do harm. We were there, to provide a good service. We could go in and talk about why it was good to get shots and why it was good to get boosted and why it was good to get tested and all of those things. And not only were we able to talk about why it was good and why you should do it, we actually brought it to the neighborhoods, brought it to the churches, brought it to the corner where people could just, come and get it.
HRSA helped us to train and hire community navigators who were trusted to go into the community and provide information to the community that were hesitant to receive it from majority organizations like hospitals or other providers. So the Urban League became the trusted partner, especially when you had a volunteer navigator that went door to door, and many of them were recognized by their neighbors. We gave out culturally appropriate information that was well received. Not that we provide medical services, but we're the conduit to the community. We're the liaison. We're the bridge to the people that you have not been able to reach because we are the trusted partner. But we need the resources in order to do that. And this grant has allowed the Urban League to do that.
When we get initiatives like this, it's nothing for us to call on all of our partners within the city, from the hospital district to the city of Houston to the health department to all of the school districts. When we call and tell them we have a program and we're on the way, they open the doors for us.
So GLT Vax is a national organization. We use proven electoral, labor, and community organizing strategies and tactics to inform, educate, and ultimately move people to a yes on getting vaccinated. So we actually serve, one, as the training arm for those health navigators, but also we help to support with the different tools. So we provide canvassing tools, we provide phone banking tools, text messaging tools, digital support.
Our navigators range from a minimum of 18 years old to the upper 60s. We have retired ministers, we have retired teachers, we have African Americans, we have Caucasians, we have Native Americans, we have those that are bilingual as well, that speak Spanish. So that was really well received because there was a well-mixed population for the population we serve. We really try to advertise to make sure we got a well-grounded mix of folks that we serve in the counties.
Some of the people that we employed actually had lost their jobs because of COVID, and so it really kind of gave them hope and a sense of purpose.
The community response to the Navigators have been with open arms because we just don't come with the information on COVID. We also bring them the multiple resources that the Urban League offers because they rarely have someone coming into their neighborhoods or into the community, knocking on their doors and interacting with them and asking them, is there anything that we can do to give you a better quality of life?
What I've done is also set up an open window every day between like 6 and 8 in the morning and in the evening. Hey, here's a window. If you got a question, text me here and I'll answer you. I'm all in. And I've had people text me, hey, my son needs a shot. Where can I go? Or how do we get you set up over at our event? So see, we're not a 9-to-5 society. So the use of social media, the Urban League has a website. These are some of the ways that we've got to think about getting to the people that need to get that vaccine.
We know how to talk to people. There's a language that we use that other people can't use. And we have the relationships that let them know that we won't do you wrong if you got a COVID shot.
I've been in this pediatrics business long enough to know that it's just not easy to just come to a mom and say, hey, let me just inject your child with something and let's all hope everything's gonna be okay. This requires relationships and important conversations. Those are conversations that can only happen in certain circles and only when they're hosted by certain organizations like the Seattle Urban League. Sometimes, I don't know, university or the health department might want to have the same conversations. They're not going to work the same way because there's not relationship, there's not history, there's not a deeper understanding, there's not credibility in the same way. The source matters.
As a team, that is our main priority, is making sure that our community trusts us, because without the trust, they're not going to come and support. They're not going to attend your vaccination events. They're not going to come to your health screenings. They're not going to do those things. So building that trust definitely helps.
Going into the community and partnering with religious organizations such as churches, barber shops, hair salons, local orgs that at one point we didn't even realize they were there and what they meant to the community. The owners of those locations, they had influence on the community. And with that partnership, we were able to vaccinate more people than we did alone.
As COVID hit us, we started looking outside as to kind of who's out there doing good things. And Urban League has always been in my mind, but I'm not too sure even who approached who, but the thought of having a booster and COVID testing opportunity at our Seattle location and then as well as in our Renton location became kind of the start of us doing something together. We felt that it was something that the community needed. One, just to have the spaces to go to, and Urban League being able to amplify that voice, providing the connection with the trusted clinic here locally to administer, and us being a hub, a space to allow that and to provide and to support that to happen was the start of it all.
I think what's really, really important for me is that it's easy to give up. It's easy to get frustrated when the numbers are not where you want them to be as fast as you want them to be. The Urban League, they stayed with it. And although people are like, oh gosh, you got those numbers so fast, it's not easy. It's not easy to go to an event and you only have 2 people show up. It's not easy to go to an event and say, okay, this week we had 10, but next week, the following week, they only had 1. Just the initiative and the drive to stay with the mission and to complete the goal of getting people vaccinated.
So I went down to get my shot, and I'm very happy that I have them. Even though there's a line, it's a joyful line. It was an easy process. They welcomed us. They were very nice. And it's really good to see that there's organizations that care about people's health and that we're protecting each other.
Going to a church, I was comfortable
They were very organized on how they had to set up and what station you were supposed to proceed to next. I didn't feel so anxious or I'm like, okay, I'm going to get a vaccination. I'm going to get this done. And it pushed me further along to get it done.
It's a real privilege, it's an honor to be able to provide this service to the city of Houston through the Urban League and through HRSA. I'm amazed every time we open the door here in Houston at one of our events, the people show up. And so it's just been a real blessing for the city of Houston to be able to have a program like this to serve the great people of the city.
My voice is not as important, especially when it comes to these issues, as our citizens in the community, because they also have networks. And when the community sees them promoting it and lets them know that they took that opportunity and chance to make sure that they were healthy, it gives a different kind of credibility, a different kind of encouragement when they are hearing it from their colleagues and their peers and their neighbors.
As a navigator, when I see the results of my community navigators working for the Urban League, getting the word out, they have big hearts too. I think that's why we work so well together, because we all care about our communities.
We serve the community together as a community. Because I'm not just advocating for brothers and sisters in the community, I'm also advocating for the 3 Black children that I have, for my Black wife, for my mother-in-law.
COVID has really taught us about resilience. It's taught us about breaking points. It's taught us about what our capacity is and what it isn't, and learning to be okay with asking for help.
Is one day I was at the Kroger's getting groceries, and I heard a lady say, "Hey, lady, you're the woman that saves lives." I didn't know that she was speaking to me, and she said it again, "Hey, lady, you're the lady that saves life." And when I turned around, she was pointing at me. You're the reason that I got a vaccine, because it was accessible in our community. I can see you from a distance. I saw the signs, I saw the tent. I was curious about how I was going to get this vaccine other than calling the 1-800 number. That is a story that stands out to me. The lady that saves lives.
I was able to do a tag along when we went to someone's home. This beautiful woman that I never met before with her daughter were talking about how grateful they were that we were providing this service, and that they didn't know how else that the mother would have been able to get vaccinated if we didn't have that service in play. I'm trying to say this without crying, because it just drove home for me how important our work was. And literally, if that was the only woman that we helped get vaccinated, everything that we did would have been enough.
I don't take these clinics lightly. I don't see it as just any other day, any other experience. I see these as really potentially transformative moments, because a lot of the people I talk to, they hadn't been to a healthcare clinic in 10 years, or they avoid the doctor at all costs until they have to go to the emergency room. And so for them to show up to a vaccine clinic, it's a big deal. And so I want to show them healthcare can feel good. Healthcare can be for us, by us. There are nurses and doctors and researchers that look like us that we can talk to and really start to transform and heal what that relationship with healthcare can be like.
And I think that the outcomes, the successful outcomes, they really, they come from the fact that our community is hearing we've got to be all in, whether it's COVID-19 or anything else. And our community will only hear that from folks that they trust. And I think that this funding, if it goes away, you lose connectors like the Urban League that can connect our community to the kind of precious resources and the things available to really work on helping our community be healthier, and then as well helping our community be educated so that we can really not only just be preventative, but be action-oriented about our health and be all in to make sure we have a vibrant, healthy community.